Go live now to comments from House Minority Leader, Democrat Nancy Pelosi, as she talks about her meeting with President Obama this morning on the nation's health care law. This is live coverage on C-SPAN 2.
Okay, good morning, everybody. We had a great meeting with the president. Virtually all of our caucuses attended. He was very inspiring, telling us we were working out our strategy, and we have a great deal of optimism that the good things that have happened in ACA are going to stay, and that our Republican colleagues don't quite know what to do. They're like the dog who caught the bus. They can repeal, but they have nothing to put in its place, and that means so many good things go away. That was basically the summary of the meeting. Now, I want to thank my colleagues for being here, Leader Pelosi and our leadership team. Let me just thank Senators Harrison, Sanders, and Klobuchar, Warren, Stabenow, Pat Murray, Baldwin, Holland, for coming. And again, the President articulated the importance of preserving the Affordable Care Act, Medicare, and Medicaid as only he can. And it was an inspiring meeting for all of us. It was probably the last time the President will address the joint caucuses together. It was valuable to hear, of course, because the first big fight of this new Congress will be over health care. Republicans are plotting and soon will be executing a full-scale assault on the three pillars that support the American health care system: the Affordable Care Act, Medicare, and Medicaid. The Republican plan to cut health care wouldn't make America great again. It would make America sick again and lead to chaos instead of affordable care. Republicans would create chaos in the health care system because they're stuck between a rock and a hard place. They have no idea what to put in place of the Affordable Care Act. For years, they've talked about repeal, but for 5 years now, they have had nothing to put in its place. It all starts with the ACA. As we all know, the ACA is a delicate balance. President-elect Trump even expressed support for the three most popular parts of the law: pre-existing conditions, allowing young people to stay on their parents' insurance until age 26, equal treatment for women. But Republicans will soon learn that you can't keep the good parts of the ACA and remove the rest of the law and still have it work. That's what they're struggling with, and that's why they're not getting anywhere. What they would do would throw the entire insurance marketplace into chaos. Plain repeal. It would increase costs for all Americans at all income levels. It would blow $1 trillion hole in the deficit. And now I see the President-elect was tweeting again this morning. He said Republicans shouldn't let the Schumer clowns out of his web. Well, I think Republicans should stop clowning around with the people's Medicare, Medicaid, and health care. The Republicans are stuck. For years, they've promised every conservative group in America that they'll repeal the ACA, quote, root and branch. Until today, they could make those extreme promises without suffering any consequences, because they knew Democrats or President Obama would ultimately block any rollbacks in ACA. But now Republicans in Congress are, again, like the dog who caught the bus. They can't keep all the things that Americans like about the ACA and get rid of the rest without throwing the entire health care system, not just those on ACA, but those with private insurance, into chaos. One of the things they'll hurt the most is rural hospitals right in their heartlands. The minute they enact this repeal, are going to suffer dramatically. In 11 state capitals, many in red states today, rural hospitals are protesting the Republican action. So, we're here today to warn the American people that the Republican plan to cut Medicare, Medicaid, repeal the ACA, will make America sick again. Instead of working to further ensure affordable care for all Americans, they seek to rip health care away from millions of Americans, creating chaos in our entire economy. Now, as my colleagues will outline shortly, the Republican plan would kick millions off coverage, whether it be Medicare, Medicaid, or the Affordable Care Act. It would cause premiums of many people to skyrocket. The 75 million who are covered by private insurance, their premiums will go up too. It would harm hospitals in rural areas, and it would put insurance companies back in charge. We stand here united. United. We are a united caucus. We are two united caucuses. And we're united in our opposition to these Republican attempts to make America sick again. And now I want to turn over the podium to Leader Pelosi.
Thank you very much, Leader Schumer. I associate myself with your remarks. You covered a lot of territory there. I, too, want to join you in commending the President for his presentation this morning to us. It was one of confidence. It was one of values. That the Affordable Care Act was transformative in terms of what it meant in the lives of the American people, and that health care in our country is a right, not a privilege. If there had been no other reason for us to pass the Affordable Care Act, one compelling reason was cost. The cost to the individual, to families, to businesses, small and corporate, and to the public sector was totally unsustainable. So we had three goals. One was to lower cost, other to improve benefits, and third, to increase access. In all three of those arenas, the Affordable Care Act has been a big success. When we talk about rolling back the Affordable Care Act, we're also having an impact on Medicare. The Affordable Care Act prolonged the life, extended the solvency of Medicare. It had expanded Medicaid. This is very important to America's families. A former speaker once said all politics is local. Well, in this case, all politics is personal. So when Leader Schumer talks about the 75% of the people who get their benefits in the workplace, and that is so, they are affected by the Affordable Care Act in that the cost increase in premiums is the lowest it has been in the 50-some years that they have been tracking that. So it has contained cost. It has increased the benefit package. And as the leader said, in terms of no discrimination in terms of pre-existing condition, no lifetime limits, no annual limits. You stay in your parents' premium. Being a woman is no longer a pre-existing condition. So the package is better. The rate of growth of cost decreased. And the fact of many more people being insured by the 20 million people who are now insured who did not have access before. The most privileged person in America has better health because if everyone has health, everyone is in the loop. Now, the Republicans say repeal and replace. The only thing that has going for it is alliteration. They have no replacement plan. They have no replacement plan because they can't agree. They don't have the votes for a replacement plan. So to repeal and then delay is an act of cowardice. That means we don't really know what we're doing. And it recognizes that the consequences to them of just straight out repeal without some replacement. So we have a values debate on our hands, but it's very personal in the lives of the American people. A friend of mine just told me his grandson was diagnosed with leukemia. That child will have a pre-existing condition for the rest of his life. Repeal Affordable Care Act, that's a problem. Lifetime limits, that's a problem. If you're a senior, you know, Medicaid, almost half of Medicaid is about long-term health care. You want grandma living in the guest room? You repeal the Affordable Care Act. You go along with, this is part of an initiative that is part of the Ryan budget that says we're going to voucherize Medicare, we're going to block grant Medicaid. So this has a tremendous assault on the health and health security and the financial security that goes with what the Affordable Care Act has done for the American people. And so make America sick again? Is that what the Republicans want to do? I certainly hope not. Hopefully we can work together to find a path to address some of the concerns they may have, but not to undermine this pillar of economic and health security for the American people. It stands right there with Social Security, which they want to undermine, Medicare and Medicaid, which they want to undermine, Affordable Care Act. So the president asked us, are you ready? Do you have the fight in you? He didn't need to ask us that question, I don't think. With that, I'm pleased to yield to leader in the fight, Bernie Sanders. Oh, Patty Murray.
All right.
Another fighter.
Exactly. Thank you so much, Leader Pelosi. You know, Republicans have made all kinds of empty promises about how ripping apart the healthcare system with no plan to replace it somehow won't hurt anyone. But I'd like to focus on just one promise that the Republicans made, that if they repeal the Affordable Care Act, privatize Medicare, and cap Medicaid, families are somehow going to be magically better off. Republican leaders said exactly this. In fact, 3 days after his election, President-elect Trump even said he would deliver better health care for, quote, much less money. Well, President-elect Trump might be able to make that kind of promise from his tower, but workers and families cannot take it to the bank. Studies show that if Republicans in Congress rush to dismantle our healthcare system, people across our country are going to pay more. Premiums will skyrocket. Prescription drug costs will increase. Out-of-pocket costs will rise. And the Republican plan to unravel the guaranteed benefit of Medicare will leave seniors vulnerable when they can least afford it. All that will do is make America sick again. And it shouldn't have to be said, but that is the wrong direction for our families and for our economy. If Republicans think creating chaos and causing chaos in our healthcare system, heightening economic uncertainty, and burdening our seniors and our families with higher health care costs somehow makes our country great again, stronger again, they've got another thing coming. They should step back from the brink, stop putting politics ahead of families' health care, and agree to join together on efforts to make our health care system work better for our families instead of destroying it before it's too late. With that, I'm pleased to introduce Congressman Gish.
The President did a great job today reminding everybody of how now the ACA, Medicaid, Medicare, and Social Security all linked. They're all linked. It's because of certainty. And in the case of Medicare, a reminder that we have extended the life of the trust fund, as Nancy noted, by 10 years. But there's also another important consideration here. It's about the intergenerational benefit that Medicare provides. For those in their 40s or 50s who are trying to send children to college, they could never simultaneously help or hope to provide health care for aging parents. And that's the importance of Medicaid and how it's now linked to Medicare. While we have not paid a lot of attention to it, Medicaid has very quickly become a middle-class benefit because of the notion of long-term care. The idea of the growth of dementia, as it's recognized at earlier stages now, and Alzheimer's disease, has now provided, again, the whole notion of security. ACA, Medicare, Medicaid, and the bedrock guarantee of Social Security. That is the argument that is coursing through the American political system, and they are now linked in the public's mind, and subtracting or fracturing any part of that guarantee changes the whole argument.
Senator Sanders.
Not a whole lot that I can add to what the previous speakers have said, but let me quote somebody who I suspect I will not often be quoting. On May 7th, 2015, Donald Trump tweeted, quote, "I was the first and only potential GOP candidate to state there will be no cuts to Social Security, Medicare, and Medicaid." Now, the point is, Trump didn't just say this in passing. He didn't say it in the middle of the night. He didn't say it in a particular interview. This was a cornerstone of his campaign. He said it over and over and over again. Donald Trump said he will not cut Social Security. He will not cut Medicare. He will not cut Medicaid. Therefore, one of two things are true. Either Donald Trump simply lied to the elderly and the working people of this country and just made campaign promises that he had no intention of ever keeping. That is one reality. Or there is another reality, and that is right now, before Congress wastes an enormous amount of time, Donald Trump has got to come forward, maybe through one of his tweets, and say clearly that Donald Trump will veto any legislation that cuts Medicare, that cuts Medicaid, or that cuts Social Security. And if he makes that clear to his Republican colleagues, we can save us all a whole lot of time and start getting to work doing what this country desperately needs to have done.
Good job, Lee. Thank you. Okay. Questions? Oh. Go ahead, Frank.
Why don't you be available for questions?
Great. All right,
Mr.
questions.
Schumer, Donald Trump.
Frank, you're first.
My question is this: do you think that part of the issue, I'd be happy to hear from any of you here today, that the problem for Democrats on this issue is still the marketing of Obamacare? For the past 7 years, some people said, well, we didn't message this right. Now you're trying to salvage this against this threat by Republicans. And what makes people think that at the end of the day, this will work now when the messaging didn't work over the past 7 years?
Our biggest problem was that once ACA passed, people attributed every problem they had with the healthcare system, whether they were part of ACA or not, to ACA, and our Republican colleagues and their message machine did it. Now they're going to own it. And all the problems in the healthcare system, and there have been many throughout the years, no one has solved all of them, are going to be on their back. That's why they're running to do this first is a huge mistake for them and the country. It's a huge mistake for them on the basis of ACA, because they don't know what to do once they repeal. One of my colleagues called it repeal and run. But it's a huge problem as well, because now they're responsible for the entire healthcare system, and it will be on their backs. And I believe a year from now, they will regret that they came out so fast out of the box.
Mr. Schumer, Donald Trump mentioned you in a tweet this morning. Donald Trump mentioned you in a tweet this morning.
I just wanted to say briefly in response to your question. The fact of the matter is that the Republicans over the last 6 years tried to make this an ideological debate, left versus right. And what we're saying today is that is not what this is. We put the ACA in place because we found a lot of people couldn't get health insurance. Their costs were going up, their out-of-pocket expenses, their benefit package was diminished. Now I think the debate has to be practical. What does this really mean to the average person? If you repeal this, what you're going to do is you're going to go back to the days when you pay more out of pocket, you can't get health insurance, your benefit package shrinks, and you just have some skeletal plan or catastrophic plan that doesn't cover anything. That's the difference. We are now talking about what this repeal means practically. Forget this ideological debate on the left and right. I'm not interested in it anymore. And that's, I think, what we're going to point out. That's what we're going to fight. We're going to fight because we believe this matters to the average person.
Senator Schumer, what's your assessment of actually stopping repeal in the Senate? It would just take, if all the Dems hung together, it would just take 3 Republicans to turn. Do you think you can do that?
You've already had Rand Paul say that he is not for repeal without some kind of replace. You have a good number of other Republicans who are really worried about this. Now, the initial vote is an easy vote for them. It just says, cut $1 billion, do it from somewhere. But when they come back, I don't even know, as Leader Pelosi said, whether they'll be able to get enough votes in their own caucus for an alternative. And I think they're going to have a lot of trouble. So I would say that they're going to have far more trouble than they ever imagined. And as they move through it, they're going to start losing people on their side.
Senator Schumer, you have a number of red state Democrats who are up for re-election in states that Trump won overwhelmingly. Are you really willing to tell them not to work with Republicans on a replacement plan?
We are telling the Republicans, if you are repealing, show us what you'll replace it with first, and then we'll look at what you have and see what we can do. We are not going to. They're repealing. We're not. It's their obligation to come up with replace first, and I think we have unanimity within our Democratic caucus on that position.
Democrats to work with them?
Can you give us some details about what President Obama said specifically to the group about what he'd like you to do going forward and how he'll stay involved?
Well, go ahead, Nancy.
Well, let me first say to Chad's question that it's a very different story to take something away from someone. So our argument in terms of the Affordable Care Act is people have enjoyed the benefits of it. I'm sure you've seen the articles coming out of Kentucky where people voted 8-1 for Trump in districts, and yet they all are enjoying, many of them are enjoying affordable, over 60% of them are enjoying the benefits of the Affordable Care Act, and said, I didn't vote to take that away. So it's one thing to say to people, this is what you can get. It's another thing to say, this is what will be taken away from you. And that is a different case, and that is a case that we will make. As I mentioned earlier, the president's message was one of confidence in the Affordable Care Act and what it means and does for people, confidence in its implementation, confidence in the humility that we have to listen to other ideas if they have in their replace something that is that works, that gets results, then we shouldn't be opposed to that. But springing from not reducing benefits for people, not reducing the number of people who have access to care. This is about increasing access, improving benefits, and lowering cost. And that's sort of how our conversation went.
Deputy Stabenow, and one last question.
Well, it's important to stress the fact that smoke and mirrors are not going to do it for the Republicans because this has real consequences. Today, in 11 different states, rural hospitals are speaking out against the repeal of health care that is in this proposal. Tomorrow in Michigan, cancer doctors that work with children are going to be speaking out at the state capitol about what this means when we put caps on cancer treatment for children, when we say that they now have a pre-existing condition, or that the essential benefit package that we developed to make sure basic services were covered is turned away. So this is very real. We're not making up anything. This is happening across the country. We are going to be going state to state, community to community, working with people, whether it's hospitals in rural or urban areas, doctors, families, children, nurses, everybody who knows that this is real. It's 1/6 of the economy, and they're pulling the string that's going to unravel the whole system.
I just
Go ahead, Nancy.
Bobby to say something about Representative Virginia.
Thank you. When they say repeal and replace, the only thing that's guaranteed is the repeal part. If there were a bona fide replacement, as it's already been said, we would have seen what it looked like. The Affordable Care Act cured a lot of problems. It didn't cure all of the problems, but there's a difference between not curing the problem and causing the problem. One of the things that the replacement has got to do, and the reason they're going to have trouble is when they come up with replacements, they're going to have to show how it will improve things they've been complaining about. And the fact is that if you're going to have a pre-existing condition insured not at the standard rate, you have to have some mechanism to ensure that everybody is covered. You have universal coverage. If you can wait till you get sick before you buy insurance, then people will wait until they get sick until they buy insurance. And New York State showed exactly what happens when that happens, because they had guaranteed issue without mandatory insurance. When the Affordable Care Act came in, what did the cost go down? About 50%?
Yeah, we've had great success.
That's what you get when you don't have it. So when the replacement comes, and we knew what it would look like, and it's kind of hard to criticize an invisible plan, we will know how it will address the things that they're talking about. We didn't cause the problems they're complaining about, and they have a responsibility when they come up with a replacement. They'll have to show how they're going to solve all of these things they've been complaining about, and we don't think they can do it.
Senator Schumer, there are 20 million people who have health care now who didn't before this law was passed. If Republicans repeal it and they lose their coverage, what are you going to say to them? Are you going to say, no, we're not going to help Republicans replace this?
No, we're going to say, let's see the Republican plan, because the Republicans, if we put forward a plan first, they'd reject it. The kinds of things we want to do are quite different. And we want to cover these 20 million. We did already. The problem is, as was said by Frank Pallone, they're an ideological caucus. And they want to repeal it and then try to hang it on us. Not going to happen. It's their responsibility, plain and simple. And let me tell you, you talk to people in the reddest of states. They're the states that are most affected, not only by the rural hospitals, but you take Joe Manchin was on Morning Joe this morning talking about how West Virginia benefits from many of the good provisions in the ACA. And his view is the view of all of us. Let them show us what their proposal is. Otherwise, stick with what we have.
Mr. Schumer, would you comment on Donald Trump's tweet this
And
morning?
just say one more thing in terms of that. There is an integrity, a oneness about this. It was about, as I said, lowering costs, improving benefits, and increasing access, but it was a market-oriented solution. So when they throw this apple of discord or this disarray into the system, it's going to have market consequences that they're not thinking of. They don't really care that much about the 20 million who are additionally insured, although they should, because they don't like subsidies. But the fact is that 75% of the American people get their benefits in the workplace, have lower premiums, and more benefits than they would have without the Affordable Care Act, and the Republicans do care about that.
Thank
So
you.
we'll see where they go.
Thanks,
Thank you.
everybody.
Thanks.
Yeah, they can't describe
Live comments from House and Senate Democrats after their meeting with President Obama on health care this morning. Senate Democrat leader Chuck Schumer and other Senate leaders, also House Minority Leader Nancy Pelosi and others offering remarks. Democrats reinforcing that Republicans may have a lot of trouble getting rid of the health care law. We also heard Senator Schumer warn that repealing the plan would throw the insurance marketplace into chaos.